Okay, just another minute here. We're almost set up to go Facebook Live, everybody. Just preparing the stream here. Okay, Nicole and Keren, you're live.
Great. Good evening, everyone, and thank you for joining our first Team Up for Hope webinar. Tonight, I'm going to tell you a little bit about Team Up for Hope. I'm going to talk briefly about the organizations that we are working with, and also introduce you to our three panelists this evening. Team Up for Hope is an organization that was created from some real estate agents, and we were created to help address the impact of mental illness, substance use, and suicide in our community. Obviously, we all know this impacts everyone. No one is free from these challenges. So we recognized the urgency, and we wanted to do something about it. So a group of us got together and have been working for, I don't know if it's almost a year now, on Team Up for Hope. So in our exploration of this process, we decided that we wanted, our goal was to help raise funds and awareness for organizations that are currently in our community. And the two organizations that we've recognized as working on the forefront of this crisis and that could really benefit from our support and assistance was NAMI Orange and NAMI Sussex. So we've been working with them throughout the year and obtaining information and getting to know them so we could create our organization in a way that will best support their organizations. That said, to tell you all a little bit about NAMI Orange and NAMI Sussex, they are, obviously not the same organization. They're in two different states, but they are affiliated with each other. These organizations work on advocacy. They help assist individuals with accessing services. They advocate for legislation. They work with protecting the rights of individuals with mental illness, and they provide education and support to family members who are living with individuals with loved ones who they're caring for with mental illness, substance use, and obviously, suicide. So that's a little bit about NAMI Orange and NAMI Sussex. Our goal is, to help give them support. So through these, they're going to be participating throughout our webinars the next 4 weeks. So you'll get to meet some of the representatives from NAMI. So we're excited for you to meet them. Tonight, though, we are going to have 3 speakers for the topic of how, unfortunately, the coronavirus has played an impact on the services and supports for individuals who and their families face with these challenges every day. And unfortunately, just like COVID has impacted everyone, this is, if you're experiencing a mental illness or substance use challenges, obviously COVID just adds a lot more additional stress to everyone's world, and isolation and the need for supports are really critical. Not that they weren't before, but it's even more critical now. So we have some professionals with us today who are going to talk about, what it's been like getting services to individuals and their families through this process. And, we're talking from a doctor, from Robert Cubby, who runs a support group in Sussex County, and also Laura Guancion, who is a certified counselor for substance use. So we're excited to have them. I want to thank everybody. As I said, this is the first of four for Team Up for Hope. We're doing this for Mental Health Awareness Month. We are grateful for everyone who's joined. We are going to be doing questions and answers at the end, so please feel free throughout the presentation to type any questions that may come up in the chat, and we will, I think Jeff will be providing them to the panel afterwards. So like I said, please feel free to type into the chat, and then we will answer those questions at the end. I am going to introduce our first speaker this evening, and our first speaker is Dr. Marilina Ruffino, and she is a bilingual New York State licensed psychologist, and she has prior training in Argentina, which is very cool, and she is moving up to our or newly entering the Hudson Valley. So we're grateful to have her. She's a city girl. Her practice is primarily in the city, but she has a lot of resources and able to share with us a lot of information this evening. So we're very excited to hear from her. Her start of her career was as a psychoanalyst, and she's transitioned and expanded to applied behavior analysis, and she is working primarily with children and families. So I would like to introduce Dr. Marilina Ruffino, and I'm going to pass it over to her.
Well, thanks for the warm and very generous introduction. It's a pleasure to collaborate with colleagues, with my new neighbors, and with Green Team, and amazing what you guys are doing. I was moved by the whole idea when Tiffany Megna approached me. So thank you all. And yeah, I want to make this as bring it close to home as we can. And there's so many ways in terms that we can approach the issue, but stigma in terms of mental health has been long lasting. Pre-COVID, this just augmented the need, because we're responding to a crisis. It's common sense that we, especially children, when we see, and you see in the presentation that I'll share with you, when we say the kids are acting out, yes, of course they're acting out. We are acting out. It's been challenging, but part of this, my invitation for us to think together, to share resources, to see what's within your reach, to help you cope with your family and your close ones. Talking helps. I do the work that I've been doing for many years with families and children and adults because talking helps. We're not reinventing the wheel. So therapy is about creating an intimate relationship with somebody that you can develop trust, to talk about trauma, to talk about past experiences that are still affecting you. So of course, this is going to have, part of this is how to talk to children about it. And sometimes it is not through the dialogue that adults can engage in, but rather kind of a playful way to see where they're at. So, and that takes, teachers know better than we do how to do that. But also is understanding the emotional development and needs of a child that sometimes as adults we forget. So we do, with no further ado, I think if I'll share my very humble presentation that, let's see, share, and now, not scholastics. I will share this. Can you all see it?
Yes, we can.
Yes.
So again, talking helps. Neuroscience has shown us that. Why does therapy work? And one of the goals for this is to reach out not just to a family friend, but to your health insurance. Find out who can you connect, who can you talk to, how can you help a friend in need And also working with children, I think it's important to understand how to work with a family, and the values and beliefs of a family system is important, of the community too. So, I think this is just overemphasizing an issue that, but it does not need to be dismissed, of what we are going through and the impact that this will have. They keep calling it a pandemic because it's a cluster of epidemics. And we just had also issues pre-COVID that it just exacerbated, from social inequality, from a health system that has been struggling with stigma on mental health, that has been struggling. So we're trying to, I guess that's why I was so drawn to this project, as like, let's talk about this. Let's bring it closer to everybody, to the more people, the better. The same way we talk about preventive medicine in terms of health is preventive mental health. This part of this is we're responding to a stressor, and the brain and the biological functions need to be understood. So we need to be educated. So again, we heard this. There's so much data out there, right? It's just what to believe, what to follow. But I think it's just common sense to understand that no matter the mortality rates and who is more exposed to COVID, the effects of that are definitely, nobody is immune to it. And how we're responding, it's important to take this from an individual standpoint. And that's why I think you will see this testimonies in, at the House of Representatives, and how we've been trying, I guess, politically to bring them more awareness, but also more resources, not to forget what we're going to be needing, because the numbers so far, and I think Jeff wanted me to report a little bit more, like what was the prevalence or the incidence of mental health issues pre-COVID and post-COVID. I think we don't have the numbers yet. I've been searching for numbers, and it's hard because I think we're starting to see the response of mental health issues as a post-traumatic, as a post-response to the stressors. We were all impacted by a sudden stop of our lives, of our routines that we so thrive on. And we were asked to juggle and figure out a way to work from home, to teach our children, to help them regulate their emotions, to make so the level of stress, I think biologically, and the more we know about stress and the effect of accumulative stress, is toxic to the brain. So part of my hope is also to give you some of the simple strategies that are within your reach. Again, we don't have to reinvent the wheel, and our ancestors have also faced adversity, and how to bring this about closer to home. This is also very simple statistics. It doesn't say much, but it's kind of the common sense, but at least somebody's tracking the numbers of, we're all worried about our children and how this is going to impact their social development. And I think you all seen that. We all have plenty of examples. I was recently at an apple picking place, and you see this 1-year-old adorable toddler wanting to reach out, because that's what you want, the child to be social. When they're not socializing, like in the case with kids on the spectrum, you get worried. We're like, why? So what we're doing is this, and we are kind of blocking that interaction that is so essential so we are worried. And part of this is, okay, what do we do? How do we talk about it? It's important to find places that you feel comfortable and find also reliable information. And I said the acting out. I think the acting out, although everybody's reporting, but making space to understand why they need to act out sometimes just to express their distress. Part of this, how do we deal with that? This is, this was just a chart. It's just visual. It's nothing important, but I think it speaks of this. This is going to be an effect, and we need to pay attention. And I think I'm very happy and at ease in this community that had some value of the school system, how they've been responding. I just say kudos to them. An important issue is not because it's not happening to me. You hear a lot of people who are more introverted that they're coping pretty well with this pandemic and social isolation and being on their own kind of world. You see this in teens, not in everybody. Also with that is social inequality and access to mental health or health in general, systemic issues that were pre-COVID, and now they're just being exacerbated. And that's why you see numbers racing up for the most vulnerable populations. Stress is accumulative. The more you accumulate, it's toxic, meaning the brain does not function efficiently. So you take it, it's being depleted. So therefore, immune system gets impacted, and the ability to combat any kind of infection will be impacted. So it's complex, and I think that's a conversation we need to have, despite the complexity. So very basic, I think, and I'm open to questions and suggestions, but there's sometimes I don't give, that's why this presentation, there's no playbook, there's no recipe. And even my work with parents is like, you have to come up with your own recipe book. Like we have our own recipe book, we get from here, from there, but what works for your family? Especially in this, as a stress response, how do we cope? So you have, but at least you have to cut yourself some slack. We try to manage everything, and we're gonna miss things, and that's okay. And I think as a parent, if we want to take care of children and teenagers, we have an obligation to take care of the parents. The work that I like to do with families is to incorporate the family, the parents. And it's a delicate work, but it's needed. Empowering the parents is the only way. You're never to out-parent the parent. So also creates less of a dependence on therapy. You know, this again, it's common sense. I'm not reinventing, but this is kind of, we all need to be reminding. I need to be reminded of that. For me, it was extremely challenging. Even though I can sound like, oh, she has it all put together. No, it was extremely challenging. I was invited to write an article on how did I do being a mother, working in therapy, and then with my child. I'm divorced, and how do I manage all those stressors simultaneously? It's been challenging. I've been going to therapy, I've been talking, and trying to talk to friends, colleagues, to just figure it out. How do we do this? Again, talking helps. Consider that how much in terms of you know, electronics, we have to think, and that's why I think it's being so challenging. We've been asked to figure it out. Okay, how long does my child need to be on a, you know, and there are lots of recommendations. A couple hours, you know, pre-COVID were certain recommendations. Now it's like, just do what you can. Limit, but do what you can. But it has to be, we need to be educated on the impact of just letting a child being on a screen is toxic. Why? Because you're overstimulating the brain. So remember, accumulative stress is too much adrenaline and cortisol, so therefore it impacts the other functions of the brain. And have a conversation with a professional in terms of how to do it. And that has to be built in a collaboration. And that's why it's not, for me, it's not helpful to give kind of like, okay, do this, you know, parenting books. How many parenting books do you see out there? I think we should all write a parenting book, because we all are, you know, have a different way of saying things. We can take guidelines, what works, but then tailor it to your own family's needs. Again, the achievable goals is very subjective. Achievable goals depending for what family and what have you been used to it and what. So we being as adults being asked to put into this task of constantly reorganizing. We want routines, but routines need to be rethought. But I think resilience comes with adaptability and flexibility, being able to adapt. We are coping with stress. And that has to be a given. We're not going, okay, it's all good. No, we're not there yet. And we're functioning at a kind of as a stress response. So finding ways to normalize some kind of structure during the day is key, just from a general health perspective. Mindfulness, you know, we all been hearing this is the buzzword, yoga. Why? Because you try to stop the thought processes, the ruminations, the engaging by activating the senses. So get educated on how to do mindfulness activities with kids. And sometimes, again, it's not rocket science. Going fishing is a mindful activity. Going on a ride bike, going on a walk is a mindful activity. Tasting something, you know, saying just focusing on the 5 senses. That's what basically mindfulness is. And focusing on the breathing, lowering your heart rate, and cleaning some space in your head. And kids, my daughter at some point back and forth from the city, she would say, I feel muddy, mommy. So what I would get barefooted and go into the stream and just get connected to the ground. So this is what we mean by mindful. You know, anything that you can incorporate that involves nature to lower the stress level. Also, lots of research that support that, my experience. What else? In terms of stay connected virtually, is a little bit of what we're doing. We have a need, we're gregarious. We want to be connected. So we've been curtailed of a most essential part of our development and our being. Some people are introverted and they're doing good with isolation, but it's not for everybody. So finding circles, finding ways to interact is key. Socialization has been shown in research, different health outcomes to be a protective factor, meaning it will buffer stress. Socializing, it buffers stress. It buffers cognitive deterioration during aging. Socialization. So finding ways to work around being creative. Again, accept your feelings. Part of this is it's a mishmash. Sometimes we're like, what are we feeling? I don't know. Sometimes I feel numb. So meeting yourself where you're at. We don't have to always make sense and know who to talk to about these issues. Find a friend that you can like, you know what, just let it go. And also feel like you have it together when you have to show your kids, when your kids need you to be the stronger, wiser, and bigger adult. We need to be that for their kids. Even if we pretend it, even if we say, you know, I have no idea what's happening. You still want to show your child, I got this, right? We got this. Not to dismiss their feelings like, oh, everything is going to be okay, just move on. No, you can acknowledge it's like, you know, yeah, this is, you feel like that's not fun. What are we going to do about it? And using the we language, it brings me to this systemic, in terms of systems and family systems. How do you use, when I say we're in this together, we are in this together. You as a family use the we language with children. We are as a team, and that's why team green is like essential for family therapy. How do we do it? Again, I think there's things you can do with your kid in terms of coping, in terms of using nature and mindful activities, the routines, as I mentioned, again, as much as you can. Some families have found helpful to print a schedule because it is changing. Sometimes we get to a schedule, okay, we're set. And they're like, oh, no. So again, juggling again. And therefore, for an adult, we have to make sure that you as an adult are taking time for self-care, taking time to recharge, to rest well, to eat healthy, to get air, to go for walks. It's essential for you to take care of yourself. Is like the whole idea with the mask on an airplane, you put it on first, and then you put it on the child. That's kind of the same concept. Work and play, you have to alternate. We're creating a new routine. So we can't follow the same parameters as before. Like now it's like, okay, work is like, no. Our brain gets satiated, our brain gets depleted. So we have to mix it up. So we're learning as we go. Again, not new for the species or in terms of humans. We've been tested before how to adapt. And yet again, this is another experience. The positive attention. You know, this is like the child said, you know, we're starving. We're all starving for attention, especially children. Why? Because you need the others' feedback. You want the other ones to. So part of this is instead of, you know, how to expand the kind of statements you said to your child in terms of you don't have to, and lowers the expectations. And lower expectations is not a bad thing. To begin with, they were too high. Being realistic expectations, at least you got started. You know, sometimes we have this inertia, this inability to kind of get up, we get tired, right? We're all experiencing the symptoms of like, what is this? And not everybody, might not be a shared experience, but I think it has been, and it's being reported. So how to take care of yourself and notice this in your children. With teenagers, I think it's difficult because it's a different challenge. They want to be left alone. Part is how much do I leave them alone? Shall I leave them alone? And again, this needs a conversation. It's not a recipe for all, if that makes sense. Validating the feelings. Again, I mentioned this before. Not rocket science. I think I'm being mindful of the time, right? So these are just general. I'd be willing to share this, but NAMI, my colleagues, they know I have this information, things you can share. I'll share also my slides if anybody wants it. So yeah, thanks for your time, and I'm open to any questions.
Dr. Rufino, I'm going to pass it over to Keren.
Thank you, Dr. Marilina. That was impressive. And I'm sure there'll be plenty of questions for you at the end because there have been quite a few of them on the chat. So thank you very much for sharing that. Next, we have Bob Cubby. Bob is a graduate of Montclair State and a retired captain, serving 38 years in the Jersey City Police Department. As a result of his service, he was diagnosed with PTSD. He has since retirement volunteered helping veterans and first responders dealing with PTSD. He facilitates a peer support group for veterans and first responders. He's currently part of the crisis intervention team training taking place in Sussex County, where 20% of all officers are in the process of being trained in crisis intervention, including de-escalation techniques. Of course, that's been placed on hold as a result of Corona, and Bob will fill us in more in regards to what he does on a regular basis and how Corona has affected the training that he does with first responders and people with PTSD. Bob, the floor is yours.
Thank you so much, Karen, and thank you, Dr. Rufino. I share quite a bit of what you presented in with my veterans and my first responders. So it's to keep in mind the mindfulness and the meditation, getting away from the negative news feeds, you know, walk away from it, run away if we have to, but you know, just try to cut the cord that we seem to be attached to the TV and all the news that comes with it. Jeff had, you brought up that Jeff wanted some numbers, and as you said, there's nothing existing now except for, and so I'll share this projection from the Meadows Mental Health Policy Institute model, and it's based on pandemic unemployment rates, that if it ends up rising to 5%, which would be considered the level of the Great Recession, they're projecting 4,000 suicides and 4,800 overdose deaths due to drug addiction, or drug overdose, I should say. If the pandemic rises to 20%, they're projecting 18,000 suicides and 22,000 overdose deaths. We're starting to see indications of this now with a rise in cases coming into the emergency rooms for psychiatric help. This is the so-called second wave that everybody, they were keying on the pandemic, the medical side of it, but we in mental health and the caregivers that we are involved with, and the clients that we're involved with, the projections were 75,000 deaths due to mental health concerns, including addiction and suicide. So we have a problem, and the problem is, as Dr. Rufino stated, that we have an increase in mental health needs, and so they need a place to turn. And in what I handle is a support group for first responders and veterans. And we were going and meeting, as everyone was meeting, in their support groups and in their meetings. And then the pandemic hit, and our meetings were obviously curtailed because we could not continue doing what we were doing. So now, wondering how we were going to be able to handle this problem without meeting in person. And if you remember back in the beginning of the pandemic, we didn't have the Zoom platform. I think maybe several months later, if I remember correctly. And even then it was, a touch and go. A lot of us didn't know how to handle it or how this would, affect our support groups. Zoom is a new technology, and for a lot of people that are impacted by mental illness, this is a challenge for them. It's very difficult for them to learn new techniques and new challenges. So much so that a good many of my veterans refused to do it. They didn't want to pursue it. They didn't want to learn it. They were not comfortable with it. What I had seen, and again, not knocking the technology, but especially in the beginning, we were having audio instances where they were cutting out in the middle of a conversation. And when you have someone who's sharing their life story and the trauma that they suffered, and they get cut off because of the audio, repeat it, it's not going to work. All right, so I could see why my clients were not comfortable and didn't want to pursue the Zoom platform. So the way that I handled it for a good many months was just calling them and checking on them, and almost like a telephone chain between all of us, just to keep in touch. As Dr. Rufino said, stay in touch, be in touch with people during the times that we're away from each other and the times that the shutdown is occurring. So that's the way we did it. We handled it via telephone. But unfortunately, that ran its course, and my clients were not very happy with it. And they starved, literally. I can't think of another way of putting it, for human interaction face to face. And they didn't want to go on doing what we were doing. So, I'm very democratic in my support groups. I want my clients to be happy. It's their support group. So I looked, and it took me quite a while to find a suitable location under the circumstances and under the restrictions by the CDC in the state of New Jersey. And we were obligated to be outside because trying to meet inside was next to impossible. We were able to find a location up in Branchville at the enough and generous enough to allow us to use their outdoor pavilion. We socially distanced. We had masks on, even though we were outside. So I would rather be safe and that my clients were safe. But obviously now we're running out of daylight and we're running out of heat. It's getting cold out. So it came to that point that I'm going to have to make a decision and try to find an indoor location. And I was lucky enough, and again, generosity of a local church in Andover offered their space to allow our group to meet. I had to have the permission of my sponsoring group, which is NAMI, and they did not, and I can understand their reticence of doing so, recommend meeting inside. However, I was concerned about my veterans and my first responders, and I voiced that concern to NAMI, and they were, again, understanding enough to allow us to pursue this, to meet inside. But of course, with the litigious society we live in, and we are, I'm pretty sure, used to doing this by now, we have to make out waivers, we have to make out COVID history, we have to do a lot to make sure that the people who are coming to our group are safe and that everybody in the group is safe. So again, this all had to be drawn up, and that everybody was satisfied with the language on the paperwork that needed to accompany this move. But we do have a new home now, and we will be able to meet inside as a group. This coming October, we meet every fourth Tuesday of the month, except if it falls on a holiday or the eve of holidays. So obviously we wouldn't meet then. So I'm excited about the moving inside. I'm excited about having the group stay together and be able to meet together. It was brought up about the CIT program that I'm involved with. I'm on the team, Police and Fire Academy in Frankfurt. And again, because of the pandemic and not being allowed to meet in person, we have not had a class for some time now. And the projected next class is going to be April of 2021. Again, because the holidays are coming up, we're not going to be able to meet. That's projected. If the pandemic rises again, that could change. That's understanding. That's understandable. That in the atmosphere that we're in now, because of what had happened, with unfortunate incidences with police officers and use of force, they've asked the Attorney General of the state of New Jersey asked for on bringing officers up to the par that is demanded of them for de-escalation and handling the mentally ill that we will probably be involved with, because we'll be the first ones on the scene. And I was happy, we were happy as a group, as a crisis intervention team, to report to the Attorney General, we've already done it. We were ahead of the curve. We were ahead of everybody else. And this is a nationwide program. So this isn't just the state of New Jersey. CIT is international. So our goal in the state of New Jersey, % of all the officers in de-escalation techniques and handling the mentally ill. And we've just about reached that goal, but now, of course, that's been changed, and the Attorney General is, I believe, looking at 100% of all officers trained in the state of New Jersey in these techniques. It's at this point a 40-hour block of instruction, and we have roughly about a 70% attendance are law enforcement, and 30% are mental health workers, because they're going to be working with us and we're going to be working with them, and we need to understand what each does. And I think the more enlightening part of the CIT program was that the mental health workers had no idea of this is what a police officer is expected to do, whereas the police officers had some training in dealing with the mentally ill and de-escalation techniques. So we're, obviously we're going to be probably changing the format between now and the next class. Probably blocks of instructions will be changed. But one of the most important parts, if I may say so myself, because it's my block of instruction, is what a police officer goes through, the stresses that a police officer goes through, the PTSD aspects of for the signs and symptoms of PTSD. And as Dr. Rufino said, the coping mechanisms they can use before it gets out of control and out of hand. And one of the best that I've seen, and the simplest way, is to breathe. Controlled, doctor is agreeing with me, thank you. Controlled breathing, meditative breathing. And as it goes back to what our mothers always said, right? Take a deep breath and count to 10. Nothing wrong with that. It just brings us back to a center where we need to be, resets a lot of our systems that are kicking into high gear in that stress, fight or flight mode that we're entering into because of a stressful situation. And it de-escalates that, diffuses that, and brings us back if we were to look at the levels of the brain, we were entering into the reptilian brain as a survival mode, and we don't want to be there as a police officer. We want to be in the mammalian brain, where we can think and make determinations of what is right and wrong. And by taking a couple of deep breaths, that's what you do. You reset it. So these are things that we teach. This is what I teach in my support group with my co-facilitator, John Drinkard. And that we teach coping mechanisms to our veterans and our first responders. But it's also what we teach in the CIT training. So again, I thank you for your time. And if you have any questions, please feel free to ask.
Bob, thank you very much. We're going to be doing questions at the end.
Okay.
Thank you very much for sharing all that information with us. So next we do have Laura Guancion. Laura has over 18 years of experience working in the behavioral health field, and particularly with Sussex, Morris, and Warren County individuals ranging in age from 5 to 74 plus years old. She is a licensed professional counselor, as well as alcohol drug counselor and approved clinical supervisor. She's highly involved in the County of Sussex as co-chair of the LACADA board and board member of the Human Society Advisory Council and Opioid Fatality Review Team. Laura, the floor is yours.
So, can everyone hear me? Just want to make sure. Okay.
Yes.
I can hear you.
I'm not sure how much time I have because I'm an endless wealth of knowledge, and I can talk probably ad nauseum. So if you can let me know how much time I have, and I'll just spew out everything that I can provide for you guys. And if not, I will provide, everyone with contact information of who they can need to contact for any type of services, particularly for Sussex County.
Is 10 minutes good? Sufficient, Laura?
Sure, I can run through this. So I work for an agency that provides substance use services as well as co-occurring. And I have an abundant amount of experience for a variety of the things that we've been talking about. I just want to put out a couple of facts. Prosecutor Francis Koch from Sussex County, I believe it was about a week ago, had noted that the overdose fatality rate in 2013 was 13. In 2019, there was 40. Currently, right now in 2020, we are on pace to exceed that at 41 at the very least. Fentanyl is huge right now, and it's not just in the heroin. They are lacing it in the marijuana and the cocaine that's being distributed. And I know that in Sussex County, there was at least 2 huge cocaine busts during the pandemic, which coincides with the huge uptick in cocaine use when that's not the substance of choice for people. It is, there's the Drug Monitoring Initiative, and their reports have indicated that people have been Narcaned and said, oh, I didn't do heroin, I did cocaine, or I was smoking weed. And unfortunately, their blood alcohol levels and all their blood work have come back that there's fentanyl in the system. So on the February 13th, 2020 release for the DMI, it was a state police report for Sussex County. There was a 175 increase in reported suspected drug-related overdoses just in January alone. In January 2020, it was 175% increase from the 4 suspected overdose from December 2019. And that's just 1 month worth of data. I myself know that in the last week, there have been people that have passed away. And of course, there has to be the medical examiner's report, but it's not just opioids. And I think there's a huge focus on that right now when it's so much more than that. I like to refer to people, addiction is not just the person who is being affected. It's a very much a wraparound philosophy that we all need to have. We're all like a stagecoach wheel and, Oregon Trail. And it's one person, the identified patient in person, is affected. We pull them out, we treat them, then we put them back. However, that whole stagecoach wheel is all uneven. So we can just work on the one person, but it's a whole aspect of life. And that's why there's that whole level of care index, the whole aspect of one's person. It's whether they're in immediate need of treatment, whether there's biomedical concerns, whether there's emotional, behavioral, cognitive deficiencies, whether people are ready to change or not. Whether there's continued relapse or potential for relapse, and then whether there's a recovery and living environment that's working for them. During COVID, that wasn't there. People were isolated. There was no socialization. They had struggles with internet, particularly in Sussex County, internet connectivity, whether they had the access to services, and financial aspect. People couldn't pay their bills. They were stressing. I'll tell you that the clients that I worked with, within 1 week of the shutdown in New Jersey, that all of their dealers were messaging them, contacting them, saying, hey, I have stuff, let's do it. And then the pressure for that. And sometimes, without lack of contact, without socialization, without being in person, there's a huge accountability. If people aren't ready to change, they have other entities involved, they kind of rely on that to hold themselves accountable until they are ready. It's few and far between where people in substance use treatment are doing it willingly. I could probably count on my one hand how many people are self-referrals. So again, cocaine was a huge increase, and alcohol abuse and the emergency department admissions was a huge increase, particularly in Sussex County. I myself working with individuals and doing telehealth, and thankfully we were able to do telephone calls. There was a little bit of a leniency during COVID. And at least checking in with people, it was phenomenal. I myself had to do a lot of wellness checks, call the police officers, call DCP&P and report that, hey, this person has relapsed and they have children in their care. And unfortunately, with COVID, it was a difficult time for people to get out. But I'm very thankful for Sussex County. The police responded phenomenally. DCP&P was consistently involved and communicative, and it was just, I honestly can't say enough. During COVID, cabin fever is a huge thing, and it wasn't just for people who have mental health and addiction issues. We all got cabin fever. Sometimes, when people are in treatment, they're learning new skills. When we start our addiction or mental health issues, that's where we're stuck in life. Our brains don't fully develop until about 26 years old. So if we start using or having issues before then, we're kind of stuck in that in life. So when people are still learning the skills they need to, quote unquote, adult, when they're stuck trying to do that in a quarantine aspect, they struggle. And they're because they don't have the resources they need to develop those skills. I have to say, and I just want to plug these entities. Rutgers has an IME hotline for addiction access. It's a toll-free hotline. They 24/7. You call, you need help, you call them, and they will do an assessment on the phone and give you all the information, whether you're not insured, have no insurance, or have commercial insurance or wherever it is, and they'll give you the locations. That number is 844-276-2777. Again, there's also the CLEAR program is phenomenal. You can walk into any local police department in Sussex County and say, hey, here's all my drugs and paraphernalia, but I need help, and they will get you help immediately. Kudos to Bob. I think I was in your training for the crisis intervention team for New Jersey. They are also phenomenal. That 40-hour training, I was a part of it, and you cannot surpass that. It is social workers, counselors, ER, police department, and you're allowed to see and learn exactly what it takes for all entities and what everyone deals with, even Division of Developmental Disabilities, how to deal with every entity. And I think that was a huge impact for the manner with which Sussex County deals with response calls, because you don't know what you're encountering, whether it's addiction, mental illness, or whether it's behavioral. So I love to plug that too. For parents, Perform Care for New Jersey. I have been working in this field for so long, and I don't know why no one knows about this. Perform Care, the number is 877-652-7624. That is an entity you can call and get talk to someone, get an assessment on the phone as to whether your child has emotional and behavioral issues or substance use issues. And they will do an assessment, and then they come and meet with you. And that too, they will connect you, whether it's mobile response, whether it's a care management organization, who will do a family team meeting and connect you with the resources. And I think it's particularly important because they will connect you with the intensive in-community short-term services for counseling or behavioral assistance, or a mentor that is not apparently going to be provided anymore through the schools. And that's going to be a huge benefit for everyone, and endless wealth. Let's see, there's for parents, you need assistance. Family Partners or Morris in Sussex counties. They will give you education, give you support. They will attend your IEP meetings, the school systems. I believe they are located in Newton, New Jersey, and I believe their phone number is 973-940-3194. They will help advocate for you, particularly for 503, I think it's called, plans, or the the IEPs, to help educate you, because sometimes even, when you go to the doctor, you hear a lot of information, you walk out, you're like, oh my gosh, I don't know what I heard. They will help educate you, be a presence for you, and help advocate for you. The Sussex County government website has a human service resource guide. You can print it out, or you could just click on all the aspects, and they will, you can find anything you need in Sussex County. Some of which, there's a lot. Project Self-Sufficiency in Newton is phenomenal with providing it from anything. You have to just look up their website. Also, I'll give a little plug. There's a Benny's Bodega. They're based out of Andover, New Jersey. It's a DCP&P worker, knew the need. He created an agency, nonprofit, anything you need, clothing, food. There's so many resources. And also there's the disasters response crisis counselor. I know Sussex County has been a huge advocate on trying to host some type of events. You can get certified. It's just like the CERT team and providers. So anyone who, even if you don't have a particular degree, you can get certified to provide services for people, you know, at a crisis, whether it's Superstorm Sandy, whether it's there's, you know, some type of flooding or whatever it is, but you can be deployed in the county and try to provide the services, you know, the support services that people need.
Laura, thank you so much for all of that information. We're going to open up the floor for a few questions. That was a lot of information and we do appreciate it. Hopefully, if anyone has missed any of this information, we can get you in touch with any of our panelists so that you can get information directly from them. So why don't we open up the floor for some questions?
Okay, sounds good. So Keren, we had a lot of things come in through chat. Well, let's just start right from the top. I think this is more for Marilina. How can parents advocate for their children during this time? Are medications recommended, and how can we contact you to get help for our children?
I think it's going back to one of the messages that, you know, Robert and Laura, in terms of in the field of mental health, you, when it says is medication recommended, I think a conversation first with a professional just to start the conversation. You know, it's like if it's the first line of defense, medication will not be the response. That will be my recommendation. So I think a consultation is key. Use the resources that you have. I think that the hardest part is to get started, but engaging in a dialogue. Because part of this, even if 3 psychiatrists tell you, you know, your son needs medication, but you don't think it is, you as a parent, you will not give, you know, so you need to develop a working relationship with a provider that you trust, or to feel they're competent. And so how to advocate for this, for your child, you know, in terms of if you feel they need to talk to somebody. One of the many resources Laura and Robert share also had to do with call your insurance carrier. Call and ask for mental health services and see what you're covered, because also a financial situation, you know, how can you pay out of pocket when, you know, it has to be covered. So you have to do your part. Becoming an advocate, it's an active journey, but talking to people that have been through that. And I'll be happy if anybody has any questions of how to navigate the system. Even Laura was saying about the IEP and all the educational parts, that it's overwhelming because these services are not being provided. Although I think we're very lucky in this area in terms of schooling. I hope that answers your question.
Okay, very good. Next question is, how has the pandemic lockdown affected the delivery of mental health support, and what has been the outcome? Now, I think Robert spent a fair amount of time on that. Marilina, how would you respond to that? And Laura, let's also get you to chime in on that.
I would say that I think it has to do with, like Robert shared, like a lot of, I guess, veterans or first responders have not been very adamant with the virtual part. But I think at the same time, I was just sharing with you some statistics from Lenox Hill in terms of hospitals track the no-show rates. So if you don't show up for the appointment, so in terms of finances, you don't want, so it's usually a 20% no-show rate is good for the hospital. Well, they have had 0 no-show rate. What it means is that we being able virtually to access more people, because you avoid the commute, you avoid the hassle of how to juggle timings with, you know, especially when it comes to treatment and you have a family. But that doesn't mean that it's not a fit for all, right? And I think part of this is like, how do we continue to disseminate, I guess, or to share the services, what's happening anecdotally. And with my colleagues of mine, my practice, I'm full. It is a blessing. It's a field that I'll be financially secure. However, the level of stress is very high. And the demand, I don't have time, and my colleagues say the same. But I think in terms of advocating for more, you know, training for more professionals to get licensed to provide this work, but even sometimes, you know, a support group or talking to a friend. I hope that answers your question.
Bob, would you like to chime in regards to that? I know you're working tirelessly, and the fact that we now have a space for the first responders and people dealing with PTSD out in Branchville is a blessing, and it took a lot of work on your behalf. So what would you like to say?
I'm sorry, Karen, was that for me?
Yes.
All right, it was muffled. What was
I was
Bob,
just asking.
Karen's mic is a little off for some reason right
Yeah,
now. So
yeah.
Let me reiterate. I kind of
Okay,
heard what
thanks.
you said, so let me reiterate. You know, we're just talking about the delivery of the mental health, you know, services, and how that's impacted your group in particular. So would you like to chime in?
I think I would like to see individual police departments being a little bit more proactive. I know that certain other police departments, especially since they've been through the CIT training, have addressed that. The Sparta Police Department, for example, I had met with them and suggested that maybe they look into meditation, and they were telling me they were already doing meditation before they went out on patrol. So I was very happy to hear that. So this is what we're talking about. Do things, coping mechanisms that you know, are available out there, and you know, as Dr. Rufino said, we're not reinventing the wheel here. This is stuff that you know, to take care of yourself. And so if we could do this as individual officers or as the department, to make sure that the individual officers are taking care of themselves, to look in on their officers, especially the supervisors who are very close to their officers. And if they see something out of the ordinary, to take the officer off to the side and find out what might be going on with them. We could be our own support groups, even though support groups may not be available at this particular time, or for whatever reason, we can support each other.
Karen, go ahead and try to speak there. You're muted now.
Mute.
There you go.
I was just saying that Bob was working tirelessly to get the church for the first responders and people dealing with PTSD. And major kudos to you, Bob, because you didn't stop until you got them that space up in Branchville. So there was a lot of paperwork going back and forth in NAMI, Sussex, and we were all part of that. So
Yes, we were. Yes.
major kudos to you.
Major kudos to the Board of Trustees, which Karen and I are both on. And they helped immensely in getting this project up and going. So we're all here for each other, and we're all here to help each other.
So I just want to hear from Laura on the same question, because, you know, she's coming at this from a kind of a different angle, right? She deals largely with substance use issues, and it's just a little bit of a different angle than, I guess, what Bob and Marilina are dealing with. So Laura, how has the pandemic impacted the delivery of your services? Has it helped it in terms of being able to open up telemedicine, or is it not as good and the results haven't been as good?
I mean, during the pandemic, all of my staff were furloughed except for myself and my manager, Dan Slinger. And then we implemented the telehealth sessions from April till June, the end of June. We actually did reopen, and we're the only entity open for face-to-face. And I'm actually not sure, except for High Point in Flemington, New Jersey, who has implemented face-to-face services. So our clients came in, we had all the COVID regulations and requirements and checks and temperatures. And you know, they loved it. And they were, we had clients coming from straight mental health who have co-occurring issues, but, you know, could be managed with the mental health services. We had referrals coming in that were like, I can't do the virtual anymore. I need socialization. And luckily we are, you know, we're able to deal with co-occurring mental health and addiction services. So, it's sad to hear that that's not happening yet, the face-to-face, because it's completely possible. I mean, I know you need the space to do so, but there's a huge aspect of that. We have clients that were coming in, self-referrals that, hey, we're doing these meetings virtually, but I smoked weed before I did that, or I'm drinking the whole time and I just put it in a different cup. So it's unfortunate that we haven't been able to move forward to, now that we have all these COVID testing and I think for Sussex County, it was $1.8 million that's coming back to backdate because we didn't get any provisions for that. I think that it's going to be, it should be a huge push for that. And unfortunately, there's also the uninsured and Medicaid. There is no Medicaid providers in Sussex County except for the Center for Prevention in Newton or Newton Mental Health. However, working with drug court, there's drug court, IDRC, SAI, BHI, the interstate police supervision. There's little providers out there, and it's unfortunate, and there really needs to be a push. I know people, private agencies are resistant to open up to Medicaid, but people need services, and there really needs to be a push for that.
Okay, very good. Robert, here's a question specifically for you. The question is, in this climate of social unrest, are there a lot of officers interested in the de-escalating program?
Surprisingly, yes. They don't believe me. When I hear these horror stories of people depicting officers leaving the house, putting their gun on with the frame of mind that they're going to kill somebody before the end of the shift, is just so ridiculous. It is just so outrageous. If Hollywood is made out of with Clint Eastwood and the Dirty Harry, it doesn't exist. There is an officer that I know has that frame of mind. They would rather know how to get out of a situation peacefully, that everybody goes home healthy and unharmed. And if they can learn to do that in a de-escalation scenario, yes, a great many of the officers that we deal with love that aspect of it, of being able to situation. No one wants to hurt anyone, believe me, and especially the officers, because they took a sworn duty to protect and serve, and we really take that to heart.
Okay, great. Let's go to the next question here. Just bear with me 1 second. Let's talk real quick about, I put a poll up there during, I think when Robert was speaking, and the questions there were 3 questions. Number 1, do you, the attendees of the event, think that the pandemic has caused an increase in mental health issues as well as substance use? 100% of people who responded to the poll said yes, they thought there were. But this one is even more interesting. Is I put out a question that basically said, do you know of someone who has had a new mental health issue or a substance use issue as a result of the pandemic? And 64% of people said yes to that. I think that's pretty telling. That's a huge percentage. Even though it was a relatively small data sample, that's a big number of people that have said yes to that. Okay, so let's move on to the next set of questions here. As community members, how can we help? Are you still looking for future meeting places? That one was for Robert, but Marilina and Laura, let's hear your take on how people can help. What is the best way? What is the best thing people can do to help?
Laura, do you want to go first?
Sure. I mean, I can provide Jeff and Nicole with all the contact information, but again, like I said, educate yourselves, get connected, participate in meetings, and connect with the human resource guide for Sussex County, which is on the Sussex County, New Jersey government website, easily. I mean, any service that you can imagine, from food pantries to treatment services, whether you are insured, have no money, need help, go there. But just connect with people, talk, destigmatize this. It's okay. There's people have so much information, and it's unfortunate because we just don't talk about it, and it's not a secret. I am on the board of a variety of things, and I still didn't know how much Sussex County provides. So contact people, talk with people, email, question. You won't ever have all the information because there's new things coming up all the time.
I'll add something to that in terms of, I think it's important to incorporate it into the discussion that we're responding to stress. So of course we're going to see an increase in mental health issues. Part of this, yes, we're counting the numbers, and it's something that we needed to pay attention. This just exacerbated. It was a catalyst for a disaster because we had a crumbling already health system, not just because of the differences, but also the emphasis on the finances or the support given to mental health. So there's been a big push. There's lots of information and data out there how to integrate health with mental health. So some of you might go on for a physical, and that's sometimes, especially for women, obstetricians, pediatrics, and you see a psychologist or a social worker or a counselor just to talk. We're starting to incorporate, and we needed to. Part of this is also don't over pathologize, I would add. Because we don't always, I heard my daughter's is like, yeah, or my daughter's friend, I have depression, he's 9. I'm like, be mindful of how this information is being assimilated in children, and for us, how are we assimilating it? Because now I have and it's like we're responding. Being depressed in these times, yeah. Is it a disorder? So I think that's what you need to speak to a provider in terms of what is a response and what is also clinically significant. There was already a pre-existing condition. It's like PTSD is a great example, and research will show that, and Bob can attest to that. Not everybody's running with PTSD, right? To the same similar situation. Of course not. That's why we need a cookbook for every person. You have to tailor the treatment, and therefore you engage in a conversation, in a dialogue, in a collaboration. It's the only way. So like Laura said, get out. There are lots of resources. Reach out to us. We'll mentor you. We'll encourage you. There's help. I'm talking just, we're not reinventing the wheel.
Okay, that's a good parlay into our next set of questions. Now, there's been a lot of questions coming in over chat. I don't know that we're going to get to all of them, but I'm going to do my best to try to capture the intent of what all the different questions are. So let me just read these two together, and then Robert, Marilina, Laura, you guys can kind of pull this apart however you want. Why is it that mental health organizations are not considered essential, given that there is so much carnage related to mental health and COVID? I mean, what a great question that is, right? And then I also want to kind of parlay that with, why haven't the states like New York and New Jersey made PPE equipment and instant testing facilities large enough for social distancing available organizations that help people struggling with mental illness a priority, like they did with temporary hospital facilities? The mental health issues are being ignored by the state government. So we have some very direct questions about the lack of government focus on the issue of mental health and substance use. And, and that's one of my things. Laura and I were kind of going back and forth by email today. And to me, I'm trying to wrap my head around, in her case, her company is closing down facilities and support as the need is rising. So it clearly means that the money's not being directed in the right way. So I've said a lot. Why don't you guys go ahead and just jump in and kind of pull it apart?
I'll go first.
Sure, go
ahead. Especially since the pandemic started, hospital beds would be the best indicator, and mental health patients had no beds to go to because they were being taken by COVID patients. And because the health need was so acute due to the pandemic, and people literally dying in hallways of hospitals they needed to have that space. So that just the logistics of the whole situation, unfortunately, mental health took a back seat to the pandemic. Now that that aspect of the pandemic seems to be leveling off somewhat, God forbid we go back into another rise or the second wave as they were talking about. Should they start, bringing back, those beds for, mental health patients? Absolutely, absolutely. You have to understand too, and it came to mind as the conversation was going on, we have to keep in mind that how many mental health institutions were closed down in the state of New Jersey, Greystone being the most onerous of the few that were closed down. What happens to all those people then? They're put out into the community. They're put into halfway houses. They're put into places where relatives would have to cope. And so we were already overloaded on the mental health side before the pandemic ever hit. And as Dr. Rufino said, when the pandemic hit, we were already crumbling, and now we were coming down, everything was coming down around our ears, because just imagine it, for instance, and we had that happen in Greystone, that you have a person who is suffering from an acute mental illness now contracts COVID. Where do you go? Where do you go? And we've wrestled this with our task force, with the mental health board, and in the hospital. Can you believe that they can't stay at Greystone because they're going to make everybody else sick at Greystone, so they have to be moved to a hospital. You can't put them in the COVID ward or the COVID section because they're mentally ill, and you can't put them in the mentally ill portion because they're COVID. Where do you go? It was a nightmare. And so, this is what we're now facing. And unfortunately, we have to make some very, very tough choices. And that I don't believe that the choices that are being made are the best ones right now.
Okay. Marilyn, did you want to chime in on this whole discussion?
I feel very humble. This is the big question. There are lots of, I think, mixed emotions and emotions that come up for me in terms of that, relating to, what Robert was saying. So the only thing that I would add to end this as a team for hope, we're here to bring about hope. And I think I can't solve world problems. I always say this to my patients. I'm not here to solve. I understand I'm with you, but I stay as humble as I can be. So the little things we can do as a community is to take care of each other, to help our neighbor, to be there, to converse, to stop, the judgment, and kind of and open up with compassion, with understanding, with a wider scope, just not to lose hope in these times that I think we're desperately needed.
Yeah, that's good. Laura, would you like to chime in? Final thought here, and I think that'll be our last question that we have. Nicole, we'll turn it back to you.
Sure. I have to say, people who work in the mental health field don't come into this, and they all come into this knowing that you kind of go to work for the redheaded stepchild of an agency. I've been in this field for so long, there's never money coming into this field. But in my perception, this is an essential field because this is the mental health and well-being and wellness of a person. However, it's always overlooked. And it's probably one of the lowest paid jobs, but you expect people who are working 24/7 or providing services for people with mental health or addiction issues to get paid at a lower amount than, anyone else, unless you're in the private sector, and it's very hard. It takes a long time to get degrees and to be a professional and to establish that, and you can't. But it should be a push for people who work in the mental health and addiction industries to be paid an adequate amount of money because you want people who are experienced and not have all these allegations
Right.
of lack of experience and lack of help because they're just, doing it for the money. I know they're not doing it for the money because there is no money in this field, and it's unfortunate. And I think that's where a huge push needs to happen.
Yeah, and I think that just simply comes down to it's non-essential. It's not covered by most insurance policies. Therefore, the money's not behind it. And, it's hard to gain any traction for the professionals in the industry because it's hard to get paid. It's hard to get paid. So, all right. A couple housekeeping items, and Nicole's going to close us out here. There was a lot of information given today. I promise I will follow up with Marilina, with Robert, with Laura to gather all of the little golden nuggets that they presented to us today. And then we're going to create a blog post with this video posted on our YouTube channel and all of the information, including links to even something like Marilina's slide presentation that she had for us. So we're going to kind of wrap it all up and put it in a nice, easy way for everybody to find it. We'll email all of our attendees and we'll post it on Facebook so that you can find it. Okay, so Nicole, why don't you go ahead and close us out here?
All right, well, I just want to thank everyone for participating in our first webinar. I think it was a huge success. I think our speakers did an amazing job. So very grateful, yes, very grateful for each of you. So thank you. The other thing I just wanted to mention is, obviously one of the major reasons or focuses is to help support NAMI Orange and NAMI Sussex. And in order to do so, we would like to be able to provide some funding support. That being said, I know we do have a link on Facebook, correct, Jeff, for people to do donations. We could, I'm sure, share it with all the individuals who participated in the webinar tonight. But, any amount helps. And it is, tax deductible. It's a donation. We're a 501(c)(3) organization. So if you can, we would appreciate any financial support that you could provide, and all the funds would be going to, obviously, a really amazing organizations that are out there on the front lines working with, and supporting the individuals in our community. So
yeah, two easy ways to get it done. You can just go to our Facebook page, which is facebook.com/teamupforhope, or you can go to our website, teamupforhope.org, and there's a big donate button right up top. So that's how you can get it done. Okay. Thank you, everybody. Thanks for the panelists for taking all this time. It was great. And thanks for all the great questions.
Have a good evening.
Stay safe, everyone.
Bye-bye, everybody.
Yeah.